everybody. Welcome to Fall Network. My name is Gertrude Peterschmidt, and I have some things to talk to you about today on our own special edition of Fall Line. Tonight, we are focusing on a certain case of golden heart syndrome. It has risen in our own community. Her name is Susie. She's 2 years old. She was diagnosed with this syndrome, and tonight we are pulling together our team of experts to further analyze her case. Now, to address the specific, I'm going to hand this mic over to Dr. Moyers.
Thank you, Gertrude. Golden heart syndrome is included in the OAVS. This refers to 3 disorders that represent different severities of the same syndrome. Golden heart syndrome is the most severe of these forms. Generally, these disorders are congenital, which means they are present at the time of birth, and typically involve issues with the eyes, ears, and spine. Specifically, golden heart syndrome is a craniofacial syndrome. This means it has abnormalities in the formation of the face and head. It is considered a rare disease and is present in approximately 1 out of 3,500 to 25,000 babies. The symptoms of golden heart syndrome and their severities are extremely variable from one individual to another. The most recognizable syndrome of this is the presence of facial abnormalities. This occurs when the bones and muscles of the face are underdeveloped. Abnormalities can also be seen in areas of the eyes, ears, and spine, but can also involve the cheekbones, jaws, mouth, ears, eyes, and or spinal column. Cleft lips and palates are also another possible symptom. About 60% of symptoms are only unilateral. Only a third of these are bilateral. The right side always tends to be a little more severe than the left. While it is less common, approximately 5 to 15% of individuals with golden heart syndrome have some degree of cognitive delays. In most cases, golden heart syndrome occurs randomly with no trace of cause. I personally believe it may be caused by the inherited interaction of many genes and environmental factors. The diagnosis is rather tricky because there are no genetic or chromosomal tests to identify this disorder. If the child is identified by having these certain syndromes, further testing is often required. This may include hearing and vision tests, x-rays of the spine, or ultrasounds to identify any heart or kidney problems. The general prognosis varies from child to child, but is typically very positive. Most children have to be exposed to many different treatments, but overall tend to have a very healthy life. The intelligence and lifespan of these individuals are very comparable to any typically developing children. As Gertrude shared with us earlier, the focus of today's segment is on Susie, the 2-year-old with golden heart syndrome. One of the main symptoms she experiences is deafness. Deafness is an occurrence that affects many different people all over the world. There have been some recent research done by EDDE University. They found that 2 to 4 out of every 1,000 people in the United States are functionally deaf, and only 1 out of 18 of those became deaf before 18. If individuals with severe hearing impairment are included, the number raises 4 to 10 times higher. This puts the ratio at approximately 9 to 22 out of every 1,000 people. Finally, if any kind of trouble with hearing are included, the ratio then ranges anywhere from 37 to 140 out of every 1,000 people. To further discuss the effects of deafness on golden heart syndrome, we will send it over to Dr. Snyder.
Thank you, Dr. Moyers. Now that the basics of golden heart syndrome have been discussed, it is time to look at the specifics of Susie's case. When developing a treatment plan, it is extremely important for Susie's parents to understand her age of onset and the degree of hearing loss. The age of onset refers to the time at which the hearing loss occurred. Susie was diagnosed with the syndrome at birth, so she would be considered prelingually deaf. Prelingual deafness refers to a hearing impairment that is sustained before the acquisition of language. This information is important when deciding on what mode of communication would best fit for Susie. The next important piece of information to discuss with Susie's family is the degree of hearing loss. Susie was born without an auditory nerve at each ear. Therefore, she is considered profoundly deaf. The different degrees of hearing loss, in order from least amount of hearing loss to greatest, include normal, mild, moderate, moderately severe, severe, and profound. Susie does not have any access to sound, and she never has. This, again, is important to consider when choosing Susie's mode of communication, which we will discuss in further depth later on in this segment. Now that I've discussed Susie's age of onset and degree of hearing loss, let's take a look at her medical history. Susie has other medical complications along with Goldenhar syndrome. Susie did not have any family history of hearing loss. She was born without a left eyelid and has undergone surgery to reconstruct an eyelid for that eye. Also, Susie has had bilateral corneal transplants due to issues with keeping her eyes healthy and moist. Susie shows signs of her left cerebellum being atrophied. The cerebellum is responsible for posture maintenance, maintenance of fluidity of body movements, body balance and equilibrium, learning and memory, and also cognition. This is crucial information to know, and it would be important to have norm-referenced and criterion-referenced test results in order to understand the extent of her disabilities with brain function. All of this information is important to talk about with Susie's family in order to discuss possible modes of communication, appropriate school placement, and treatment strategies. Now, here is Miss Brooks, Susie's early interventionist.
Thank you, Dr. Snyder. Now that the components of Goldenhar syndrome have been discussed, I will move on to treatment options and school placement for Susie. Since the MRI revealed that Susie has no auditory nerve bilaterally, she will never hear sound naturally. Giving her access to sound by means of a cochlear implant would not be possible either, since there are no nerves to be stimulated or send sound signals to the brain. One option, however, is a relatively new and invasive procedure called an auditory brainstem implant, or an ABI. Unlike a cochlear implant, which is placed in the inner ear, an auditory brainstem implant is placed on the cochlear nucleus of the brainstem. This is where the spinal cord connects to the brain. An ABI requires brain surgery, and it is important for Susie's parents to consider the risks involved, especially since the brainstem is such a vital area. However, with a successful ABI, research shows that excellent speech understanding is possible. While Susie could be a good candidate for an ABI, it is important to inform her parents that results vary from patient to patient and that there are no guarantees for success. Whether or not it is decided that Susie will receive an auditory brainstem implant, a mode of communication will need to be selected. There are a number of modes of communication to choose from, including auditory verbal, auditory oral, ASL, signed English, total communication, and the bilingual approach. Before deciding on a mode of communication, it is important to understand the whole scope of her hearing loss. Goldenhar syndrome can affect her communication, therefore it is important to be aware of the services available in the community and to take her family's lifestyle into consideration. Teaching ASL as soon as possible would be advantageous, so she would have exposure to language. This is critical for early ages if language is to develop normally. ASL is a visual communication method, so if this method is chosen, it is crucial that the corneal transplants were successful and that her vision is functioning well. If an ABI is successfully done, using an oral method could be beneficial since there's no history of deafness in her family. This could allow for Susie to communicate more like her family and peers if that's what's desired. An oral auditory method stresses enhancing speaking and listening skills and employing technology such as an ABI. A multimodal method, such as the bilingual approach, which incorporates using both ASL and English, could also be conducive for learning to read and write in English. Whether or not the ABI is chosen as a treatment, continuing with ASL as the primary mode of communication is also a solid option. Once a mode of communication is chosen, it is time to look at options for school placement. This will be decided by Susie's parents along with an IEP team. A range of educational settings are available, such as mainstreaming in a regular classroom, pulling out of the regular classroom into a resource room, staying in a special education classroom, homeschooling, using an itinerant teacher, or enrolling in a special school. As the IDEA, or the Individuals with Disability Act, states, the child should be placed in the least restrictive environment according to his or her needs. Once again, many factors should be considered in making this decision, including Susie's mode of communication and language, academic level, social needs, and the family's lifestyle and available resources. The appropriate school placement would be the setting where the quality of her education is maximized while meeting her individual needs and preparing her for life. Now that we've covered some important aspects of early intervention, we'll go back to Gertrude Peterschmidt with Volline.
Thank you for joining our exciting episode on the Vol Line. Next week we'll be covering some interesting facts about autism. Woo! Stay classy, Knoxville. Hello, my name is Gertrude.
Okay.
Thank you, Gertrude.
Is healthy and moist. Susie also shows signs of her left cerebral.
It's critical for early ages if language is to develop.